Hello, welcome to our webinar on talking with students about substance use provided by the Health and Counseling Center at the University of Denver. My name is Ava Esikoff, and I'm the coordinator for alcohol and other drug prevention and education in the Department of Health Promotion. And I'm here with my colleagues who will introduce themselves before we get started too, starting with Waltrina.
Hello, I'm Dr. Waltrina DeFrance Dufour, Director of the Collegiate Recovery Community. And what that means is I provide programming for students in recovery and I supervise our recovery housing. Welcome.
And I'm Brianna Johnson. I am a staff counselor and coordinator of alcohol and other drug support services at the Health and Counseling Center. I'm a licensed professional counselor and licensed addiction counselor, and I use she, her pronouns.
Great, thank you both. So before we get started, we wanted to talk about why we think this topic is important to share with parents and families. So we know that we share a common goal with parents and families, that we all want our students to achieve academic success and make healthier decisions during college. We know that how a student approaches alcohol and other drugs can have a lifelong effect and have serious consequences down the line. So we think it's really important to help parents and families have these conversations because we know that students really hear their loved ones' concerns. And we know that the sooner you talk with your student about alcohol and other drugs, the greater chance you have of influencing their decision about substance use. So that's why we are here today. So I'll give you a quick agenda of the direction that we're headed. We'd like to share with you some data regarding substance use at the University of Denver. Then we'll transition to sharing some warning signs that can kind of clue you in on whether to have this conversation, when to have this conversation, and then have some strategies for how to talk about substance use, and then wrapping up with resources afterward. So as mentioned, this is a data set that we want to share with you all, since we know that substance use is often a part of the college experience. And with that, we know that substance misuse and abuse are common issues on college campuses. This data comes from our National College Health Assessment, which was administered to a sample of the student population in our spring term of 2019. Because of this data, we see that the top 4 substances that college students use are alcohol, cannabis, e-cigarettes, and prescription drug misuse. The first graphic on the left shows the percentage of actual use among DU students versus the students' perception of the percentage of their peers using substances. And this tells us that students perceive that everyone is using substances in college, which we know is not true, but perceptions can influence a student's decision to use substances or not. On the right, we have a graphic that compares our data from DU with our national data, which shows that the substance use among DU students is higher than national averages. So again, this means that we need to talk with our students about alcohol and drug use and set the norms before a student enters college and while they're in college. So from here, I'll transition over to Waltrina, who will talk more about warning signs.
So here are a few warning signs that you might want to pay attention to if you are concerned about your students' use of substances. First, you might acknowledge and identify some withdrawal symptoms: cold, sweaty palms, shakes, a little irritability. They might be trying to control their use. Maybe they want to limit their use to just the weekends. They tell you stories about how they will help each other to care for each other in their use. And they start to try to switch from one substance to another. They might start giving up activities they love to participate in, such as clubs, sports, organizations. They may feel like they're not being the best friend or sibling or son, a failure as a student. And then they'll talk about this obsession or compulsion to use, that it's always on their mind and they can't wait to use again. So these are just a few of the warning signs. Another way to identify if your student is just doing typical college partying, or if maybe it's something more that we need to pay closer attention to, is they start to isolate. They may not want to hang out with their friends, or they may not want to participate in family functions. Sometimes they're not even acknowledging that there is a problem. They can't tell that they're not even having consequences. They might be preoccupied with their use. They find that they have to use more to feel any kind of effect from substances such as alcohol. And then they have a loss of control, that whenever they take their first drink or use of a substance, that they can't predict how much more that they will end up drinking. So the fine line between typical college behavior and when a student might be entering into a substance use disorder is when they start to have serious consequences that impair their health, weight loss, or weight gain from certain opioids, disability. If they find that they are losing their responsibilities or sacrificing their social activities, they have consequences with their work, they're not being academically effective in school, they're having interpersonal and behavioral consequences, they might be in the place of a substance use disorder and might need further treatment. So we have a wonderful definition provided by SAMHSA. A diagnosis of substance use disorder is based on evidence of impaired control. They lose that sense of ability to control their use, social impairment, risky use, and pharmacological criteria, which is defined and described in the DSM. At this time, I'll pass it on to Brianna, who will present on conversation strategies that you can have with your students around substance use.
Thanks, Waltrina. So it can be intimidating to talk about some of these topics with your students. Maybe you have broached this conversation at home, or maybe it's been tough to talk about, and this is the first time you're kind of making a foray into this realm. So I think it's helpful to maybe have some ideas of how to talk about this and what kind of attitude you want to have going into it. I think it's important to understand what the situation looks like from your student's perspective. So we want to make sure that we're really coming at this from a place of empathy rather than argumentation. So you can maybe mention what brought this to your attention, why you have concerns. Maybe it's based on some of the warning signs that Waltrina just mentioned. So you might want to make neutral observations rather than judgments, and that can be something that we jump to. So we might want to scale back and think about if a video camera were recording this, what would the video camera see? And what is it that we could both agree on? So I've noticed you've talked about having big weekends. Maybe your student has mentioned that several times in conversations with you. And we can both agree that that's something that they've said. So that's a neutral observation of what's happened. We want to express care and concern. It's important to your student to know that you're invested in them, that you're coming from a place of care, that you're not immediately coming from a punitive place. And we want to utilize that relationship you have with them. So you might say something like, I know you have a lot on your plate and I'm starting to worry about you since this isn't like you. I think too, sometimes we feel that we can't talk directly about substances, that it's too awkward or that there might be pushback. But that could lead to vague conversations. We're not really sure what's going on. It's okay to be direct and clear. So you might say something like, I know drinking can play a big role in the culture on campus, and I wonder if that's what you mean by having a big weekend. So we can get specific about what might be going on. So then you might want to ask open-ended questions, and that means that we want their answers to not just be yes or no, right? We want them to be able to kind of expand on what they're saying, and that could lead to a deeper conversation rather than just getting one-word answers. So open-ended questions typically begin with how, what, when. So you might say, how's the quarter going for you? What kind of impact do you think those big weekends are having on your schoolwork? And when would you know it's becoming a problem? That invites the student to, to be able to respond maybe in more detail to you and open up a bigger conversation. You can refer them to campus resources or other resources that are in the area if you're worried about them, and make sure that they know that there is help available if they need it. And then it's important to stay in touch. You want them to know that you're going to follow up, that this issue matters, you're paying attention, and you're going to follow up with them. So you might invite them by saying, feel free to let me know what's going on. Maybe I can call again in a couple of weeks to see how things are going. And maybe you decide a couple of weeks is too far apart. Maybe you decide that you want to call them more often, whatever works for your family. But it's important that your student know that you care and that you're going to be there with them, you know, whether there's an issue or not. That's really important.
Thanks, Brianna.
And sure, Ava's going to talk about some resources.
Thank you. So again, we wanted to wrap up our webinar with some resources that you can access to learn more about this topic. One is a national resource called shifttheinfluence.org. They have a lot of resources about talking points that you can use with your students, as well as online simulations to actually practice what your responses might be in particular conversations around substance use. We also have a new student and family programs e-booklet coming out soon. Hopefully by the time you view this webinar, it will be out. So please be on the lookout for that. We have more tips about conversation starters and information there. And then altogether, our representation is from the Health and Counseling Center. So we are resources as well through our counseling services, our collegiate recovery program, and our health promotion department. And so we wanted to provide our contact information as well, in case you would like to learn more or you'd like to connect with us and reach out about these resources. You can contact us through email, or you can contact us through the Health and Counseling Center directly with the information on the right. So from here, that's the end of our webinar. Thank you so much for joining us today for this part of the series for the new student and family programs.